arthritis is just, by definition, joint pain, arthralgia, plus the objective change of something, often radiographic, but maybe a fusion, maybe some other change, rubor, tumor, calor, all those things. And if it's not autoimmune, and if it's not crystalline, and if it's not infectious, then the mechanical osteoarthritis is likely that mechanical contribution. So I think we are, one small component is we're playing more sports. So we are adding a risk of a mechanical injury that may start off as a knee contusion with a small, if we had the chance to scope at the the time of the injury immediately at the pickleball court, we might see that there is a small defect in the cartilage there that goes through a process that at age 10 would heal up nicely, but at age 50, 60 may get stuck in a process where it is constantly trying to mill down the surface and getting re-injured, and mill down the surface and gets re-injured. And eventually the body goes, cool, enough of this. Like, we're not getting a chance to heal. It may be the repetitive use at a place like a local factory where it's that repetitive motion. One of my theories, and this is truly a theory, one of my theories is that as we see in youth athletes, there is a change in the anterior thigh and posterior thigh strength where it's a 1-to-1 ratio. And then something around age 13, especially in females, seems to create a proportion where the ratio of strength is 2-to-3 posterior to anterior, where the hamstrings are about 2/3 as strong as the quads. And I suspect that when we take a look at a joint like a knee, which has a nice camber to it but moves smoothly, that there might be a little microscopic shift with every bend that we might see as a limp, but sometimes may go unrecognized. And that constant rug burn, that's the analogy I use, whether it is from an acute issue or not, there's a constant rug burn. And there are some key principles that we can address that help reduce that rug burn, either rest or exercise to rebalance the movement, or weight to reduce the total pressure, or bracing to reduce the pressure. When it gets to a surgical approach, the whole idea of osteotomies and joint replacements is to change alignment and pressure. So I think that all of those things play a role, a measurable role. But the way I think about it is definitely around what things create the risk for rug burn inside that knee, and how can we optimize that back to what we think is a normal amount of rug burn and pressure, and that's the youthful young knee that's well balanced with weight, exercise, nutrition, and the like.
Yeah, I think that's a great point, and that's probably the best explanation I've heard of about what arthritis is for our patients in a long time.